Improved advances in medicine have increased life expectancy and our quality of life, but those extra years might not necessarily be healthy ones. More people are requiring more healthcare services than ever before, and that puts stress on hospitals and long-term care facilities. Compared to prior nursing shortages in the 1980s, this time it's not about the sheer number of nurses. Instead, it's about having nurses who are in needed specialties, have skills, experience, they remain calm under pressure, become leaders, are able to mentor future generations in the workforce. If money was no object, we could hire every certified nurse, build bigger hospitals, offer superior individualized care. However, when you combine a surplus of patients with lower funding due to reduced insurance reimbursement or even patients that have no insurance at all, keeping the nursing personnel scale balanced is a constant game of tug and war. More patients bring more money, but more patients can also result in more stress, causing nursing burnout. Today, I'm going to be making sense of this nursing shortage we're being warned about, what has caused the shortage to get this severe, and how it impacts you and me, and of course, what sustainable solution can be implemented to fix the issue now to avoid a similar crisis in the future. Job security and good wages brought nursing to the front of the career line, and that hasn't changed a bit. However, according to the Bureau of Labor Statistics, there's going to be 1 million nursing vacancies by 2024. The key to filling the vacancies is to meet the demand for education and provide a good working environment to keep those employees. Based on these predictions, current resources won't be able to meet demand. Although men and women want to become nurses, there isn't enough room for them due to space and staffing limitations at schools. Plus, when nurses do graduate, they go to hospitals, despite the demand for needs in other areas of healthcare. Because of the opioid crisis, substance abuse and mental health treatment is in high demand. And that's one area where nurses are needed the most. So why is this happening? Why now? Well, number one, aging baby boomers will require quality health care. Currently, the elderly population makes up 14% of our total population, but by 2050, 1/5 of our population will be considered elderly. That means more patients will require more nurses. Plus, the nurses who have been in healthcare for their entire careers are ready for some rest and relaxation. Not to mention, losing a large percentage of experienced nurses impacts new nurses coming in who need on-the-job mentors. Plus, schools aren't graduating students fast enough to meet the demand. With limited space and staffing, universities are forced to turn away qualified applicants. Plus, they need professors. Just as they are in hospitals, nurses are leaving the teaching profession as well. Time to retire. Attracting new professors is difficult since advanced experience and education is required. Plus, oftentimes, leaving the bedside and moving into the classroom requires a pay cut. Not to mention, clinical sites are needed for hands-on experience, and even those are limited. Hospitals only have so many internship spots for a certain number of students. Nursing students need practice, but hospitals and healthcare facilities can only accommodate a limited number. Schools need to invest in technology. That's where simulation labs come in and virtual classroom. They need to think outside the box on how to get more students through and still meet the requirements they need so they can get their degree. Often we see nurse retention and burnout in the current workforce, and that is just staying, and that's remaining the same. Often overworked nurses will eventually quit due to compassion fatigue, stress, and depression. Plus, not to mention a lack of mental health resources, absolutely contributing to that burnout. And pressures placed on them, tight schedules, hard patient-to-nurse ratio. It's giving them so much stress, it's eventually having them choose to leave the profession. Inadequate employee support for those currently in the field will absolutely lead to negative employee engagement, fatigue, and depression. So what? What does this mean for us? The nursing shortage has shown that there is an absolute negative impact on healthcare based on low staffing levels. That includes poor patient outcomes, increased rate of patient injuries, increased rate of infection, a higher likelihood of hospital readmission, and higher mortality rates. Providing more access to healthcare is a great idea, so long as you simultaneously provide more staffing to handle the demand. The passing of the Affordable Care Act gave people access to healthcare that they never had before, but we still had the same number of nurses to take care of that increased rise in patients. Lower staffing will show to result in errors, oversights, and lower proper bedside care. The American Journal of Infection Control showed in 2012 that there was a significant association between high patient and nurse ratios and increased urinary tract and surgical site infection. So what's the solution? How do you fix the problem before it gets too bad? Well, number one, we need to graduate more nurses. And number two, we need to improve the work environment to retain our existing nurses. An increase in resources has to be made by schools to allow them to train qualified individuals. And it's not just new nurses that need education. Training current staff improves patient outcomes and promotes higher rates of retention. They found that 10% increase in the proportion of nurses holding a bachelor's degree decreased the risk of patient death by 5%. Schools need to focus on not only recruiting students. Colleges don't have trouble finding prospective nursing students. They need to focus their recruitment efforts on professors and trainers. Focus on recruiting and retaining the staff as current staff are preparing to retire. It's time to get creative and think outside the box. That comes to the financial obstacle of going to nursing school. We need to think about things such as tax incentives, loan write-offs, hospital mentorships. We need to help eliminate the financial obstacles of nursing school. We need to get creative with technology, such as sim labs, as mentioned before. Florida State Board of Nursing now allows students to get up to half of their clinical hours in simulation labs. Adding virtual classrooms and telehealth allows students to get the experience they need without clogging up and being backlogged with a hospital internship program. The second solution is improving employee morale, engagement, and retention. Providing opportunities to gain knowledge is one key benefit that employees request. This could include internal trainings, conferences, or even tuition reimbursement for those seeking more degrees. Part of that same employee morale, engagement, and retention solution would be to temporarily increase staffing, utilizing traveling nurses or international nurses to temporarily fix the gap or fill that gap to offload some of the stress that current workforce are feeling. Most importantly, we need to help nurses deal with compassion fatigue. In 2017, a study found that nurses are 23% more likely to commit suicide than women in general, and nurses are 4 times more likely to commit suicide than people working outside of healthcare. Finally, a great way to improve employee morale is to come up with a sustainable recognition and rewards program. There are so many different ways to incentivize employees. And most of all, employees want to be recognized. They want to be recognized in person, in front of the peers, and they want to feel valued. They want to know that management recognizes their hard efforts and appreciates it. They want to know they're making a difference and hear it. That concludes my overview of the nation's nursing shortage and solutions to avoid a similar situation in the future. Thank you for taking the time to watch this presentation.